Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're going to talk about another important over-the-counter option for allergy relief. If you or someone you care about struggles with seasonal or year-round allergies and is looking for a treatment with a long history of proven effectiveness in controlling symptoms, this once daily nasal spray may be worth considering. That medication is Nasacort, the first corticosteroid nasal spray approved by the FDA for over-the-counter use. With this episode, I have essentially covered all of the major over-the-counter nasal sprays used to treat environmental allergies, hay fever, and year-round allergic rhinitis, including Astapro, Flonase, Flonase Sensimus, Rhinocort, Nasonex, and today's topic, Nasacort. If you're interested in learning more about those other options, you can check out the previous videos, link above. In this presentation, I'll walk you through 5 key things to know about Nasacort: its indication, how it works, how to use it correctly, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Nasacort and who it's for? Nasacort is an intranasal corticosteroid spray that contains Triamcinolone. The over-the-counter version is approved to temporarily relieve symptoms of hay fever and other upper respiratory allergies, including nasal congestion, runny nose, sneezing, and itchy nose in adults and children 2 years of age and older. The prescription formulation was originally approved by the FDA in August 1996, and it later transitioned to over-the-counter status in October 2013, allowing patients to access the same active ingredient and strength without a prescription. Nasacort can treat symptoms caused by seasonal pollen exposure as well as year-round allergens such as dust mites or pet dander. For patients whose allergens remain bothersome despite oral antihistamines, Nasacort may be a good option to consider. Second, how does Nasacort work? The active ingredient in Nasacort, Triamcinolone, is a corticosteroid with broad anti-inflammatory activity. It suppresses multiple immune cells and inflammatory mediators, helping to reduce swelling and mucus production. By acting directly on the nasal mucosa, Triamcinolone treats the underlying inflammation that drives allergic rhinitis. Some people may notice improvement within the first 24 hours, but the most symptom relief may take up to 1 week of regular daily use. Staying consistent is important for optimal control. Third, let's talk about how to use Nasacort. Nasacort is for use in the nose only and should not be sprayed into the eyes or mouth. Each spray delivers 55 micrograms of Triamcinolone. For adults and children 12 years and older, the recommended starting dose is 2 sprays in each nostril once daily while sniffing gently. Once symptoms improve, the dose can be reduced to 1 spray per nostril daily. For children ages 6 to 11, the recommended dose is 1 spray in each nostril once daily while sniffing gently, with adult supervision. If allergy symptoms do not improve, the dose may be increased to 2 sprays in each nostril per day, then reduced back to 1 spray in each nostril per day after symptoms are improved. For children ages 2 to 5, the recommended dose is 1 spray in each nostril once daily while sniffing gently, also with adult supervision. If you miss a dose, take it as soon as you remember. If it is close to your next scheduled dose, skip the missed dose and take the next dose at the usual time. Do not take a double dose to make up for a missed one. Before first use, gently shake the bottle and prime it by pumping until a fine mist appears. If Nasacort has not been used for 14 days or longer, it should be reprimed before use. Detailed step-by-step instructions are provided in the package insert, but here are several key points. Before each dose, gently blow the nose to clear the nostrils and always shake the bottle, since Nasacort is a suspension and needs to be well mixed. Place the nozzle tip into one nostril, close the other nostril with a finger, aim the spray toward the back of your nose, and press the nozzle while sniffing gently. Refrain from blowing the nose for 15 minutes after using Nasacort. Avoid spraying directly on the nasal septum, the central wall between the two nostrils, which contains many blood vessels and limited nasal tissue. Spraying directly on the nasal septum may increase the risk of nosebleeds without improving symptoms. Fourth, let's review the warnings and precautions. Local nasal adverse events may develop, including irritation, nosebleeds, nasal ulcers, and in rare cases, nasal septal perforation, a hole in the cartilage between the nostrils. These risks are known with the intranasal corticosteroids. For patients using Nasacort for several months or longer, periodic examination of the nasal lining is recommended. Because corticosteroids can delay wound healing, patients with recent nasal ulcer, nasal surgery, or nasal trauma should avoid using Nasacort until healing has occurred. Localized fungal infections, such as Candida in the nose and throat, have been reported with intranasal triamcinolone. Patients should contact a healthcare provider if they notice redness or white patches in the nose or throat. If such an infection happens, treatment may include antifungal therapy and stopping Nasacort. Because Nasacort contains a corticosteroid, it may affect the immune system and increase susceptibility to infections. While on Nasacort, patients should avoid exposure to contagious illnesses such as tuberculosis, chickenpox, or measles. If you have or had any of these infections or have relevant travel or exposure history, stop Nasacort and discuss with your doctor. Using Nasacort at higher than recommended doses or together with other steroid medications for asthma, allergies, or skin conditions may increase the risk of systemic corticosteroid effects, such as hypercorticism and adrenal suppression. Ask a doctor or pharmacist before using Nasacort if you're taking other steroid medications. Corticosteroids may also contribute to the development or worsening of glaucoma and cataracts. Patients with a history of elevated eye pressure, glaucoma, cataracts, change in vision, or eye infection should talk to a doctor before using Nasacort and consider close monitoring during treatment. Any new or worsening vision changes should be evaluated promptly. In children, corticosteroid use may also slow growth. Pediatric patients should use Nasacort for the shortest duration necessary to achieve symptom relief. If a child needs to use Nasacort for more than 2 months per year, this should be discussed with a healthcare provider, and growth should be monitored for prolonged use. And finally, let's talk about the side effects and safety. In clinical trials of the prescription formulation involving patients with allergic rhinitis, the most commonly reported side effects included sore throat, nosebleeds, and cough. Nosebleeds were reported more frequently in patients using Nasacort than in those receiving placebo. If you experience frequent or severe nosebleeds, stop using Nasacort and consult a doctor. If symptoms do not improve within 7 days of starting treatment, or if new symptoms such as persistent fever or thick nasal discharge develop, this may suggest something other than allergies, such as infection. In that case, stop Nasacort and get medical evaluation. Overall, when used as directed, Nasacort has a well-established safety profile. And there you have it, 5 key things to know about Nasacort, a once-daily medication that targets nasal allergy symptoms. As the first intranasal steroid spray available over the counter, it has a long track record of effectiveness and safety. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.